leaving a trail of death and despair as the highly transmissible Delta strain put our health system into a chokehold. How can we prepare better to combat the pandemic, yet we are disadvantaged as a country? And how can we address the attendant fault lines that continue to afflict the health system? On Citizen Voices this evening are two distinguished scientists, Professor Francis Omaswa, the former Director General in the Health Ministry and former head of the Global Health Workforce Alliance, and Associate Professor Wilson Winstons Muhwezi, who is a member of the Scientific Advisory Committee on the COVID-19. Gentlemen, you're welcome to Citizen Voices, and the hashtag of this show is Amplifying Citizen Voices. I'm your host, Emmanuel Mutaizibwa. To bring you into this debate, Professor Omaswa, you've had a very distinguished career as a scientist. You are Director General appointed in 1999, and a year later, Ebola struck, one of a very complex disease to manage. And if my memory serves me well, you did well. You had a very robust response. And as years went on, Uganda became a kind of model in terms of combating hemorrhagic fevers like Marburg and Ebola. Yeah. What kind of lessons today can we learn from that resilience, that robust response that we can put to use in regard to confronting the COVID pandemic, which, as you are aware, the second wave, puts our health system into a chokehold?
Yeah. Thank you, Emmanuel. Good evening, viewers. It is true that Uganda globally has a good, positive reputation in relation to managing disease outbreaks such as Ebola, Marburg, HIV.
Yes.
And the key reasons and the lessons we learned from our history are the following. First, you need top leadership to support the response. And we have been fortunate in Uganda. President Museveni has been sensitive to these diseases outbreaks. He was very close to the HIV response, also to the Ebola response, and also to this COVID response. That leadership needs to trickle down from the head of state to the sector leaders, all the way to the district leaders, all the way to the community leaders. So leadership is key. And the key function of the leadership is to build and hold the trust of the people. That is where the battle is won or lost. If you lose the trust of the people, then you have lost. If you hold the trust of the people, then you have a good chance of fighting the pandemic. And the winning this trust by credible leaders is through very clear and consistent communication. During that Ebola outbreak in Gulu, we had a structure in the Ministry of Health which provided the leadership. The task force was led by Dr. Sam Okware, who also was the same program manager who led the HIV response. And every day we held a press conference. At lunchtime, we made a press release. When we leave the office to go home in the evening, we made a press release so that the public was aware of what was happening by the day. And then also our own behavior as leaders. It needs to be consistent with what we say so that the people believe us and they trust us. And during that time, we were able to set up structures, well, to use existing structures. Like in Gulu, we worked with the district council of Gulu, led by the late Walter Ochora. He became very close to us, and then it went all the way down to the villages. We had a village health teams, even at that time. They were established just about a year before. And it was the people who were talking to each other. Even the rebels then heard about us, heard about our messages, and they left us to control the pandemic. So strong leadership all the way, consistent, clear, and credible messages, engaging the communities, building their trust and holding on to it, and then creating those structures, the structures which were created for Ebola, like the command center, the interministerial task force, which still works today, are those things which really helped Uganda those days to control that Ebola. WHO came here after about 3 weeks of the outbreak, and they found we were very organized already, but they helped us. They brought equipment which we didn't have, and then they also camped there in Gulu. We also sent leaders when outbreak went out to Masindi. We sent Dr. Zaramba, who was the director, to live there. And we had many people actually settled in Gulu from the Ministry of Health headquarters. So you need to have a system which is very, very strongly led and which is focused on holding the trust of the people and communicating with them on a regular basis. Thank you.
Professor, thank you very much. To bring in Professor Muhwezi, you are part of the Scientific Advisory Committee. We know that we're not yet out of the woods. We just had the second wave, which came with quite a sting. If you recall, towards the peak, Kampala was like some kind of war zone. The ambulance siren, private hospitals erected tents, people had cannulas. It was nearly chaos. What lessons can we learn to prepare better? We're not really trying to blame the scientists. We're not trying to blame the leaders. But there are things that we ought to have done better, I guess, because we had a bit of time. We borrowed money from donors and the Bretton Woods institutions like IMF and World Bank. Perhaps we could have bought more ICU beds. Perhaps we could have bought, we could have ensured that we stock enough oxygen. Perhaps we could have maybe bought less double cabin pickups. What can we do better to ensure that the next time, because this disease, according to you, the scientists, it's still with us. What can we do better, Professor?
Well, thank you very much, Mr. Muteiziwa. Certainly there is a lot that could or can be done better, but I always want to believe that whatever one does in the course of preparation or execution of a duty, there are lessons learned. There are quite a number of lessons that have been picked along the way. They could have been learned at a high cost, but there are lessons learned. And I always want to look ahead because I'm a student of history, and however much you try to interrogate history, you cannot go back. You have to move ahead. So I think for me, the most important lesson we can pick from this COVID-19 phase we are in, the second wave, is that we are not out of the woods. The situation is not as we would want it to be. We still have very many people who are testing positive. They are out there in the community. They spread the virus. Vaccination levels are still a bit low. And therefore, at an individual level, for every person, there is a lot of anticipation, and one would expect that we should be risk aware. People in communities, different communities, going all the way down to the household level, we have a lot we can do. Ultimately, we now should have learned that much of this COVID-19 will be defeated through our lifestyle modification, our level of fidelity to respecting and living by the standard operating procedures. I think that's where we need to focus our attention too much. It's good to do a postmortem and to look at what did not go well, because that helps you to learn. And you know, learning never stops. But at an individual level, in this country, all of us should perceive the risk, that the risk is still actually high, perhaps higher than when we came out of the first wave, because we still have very many people testing positive, asymptomatic, going on with their life. Our vulnerable people are still very many there. The vaccination rates are still low. So there is no reason why we should let down our guard. We should still be super alert at an individual level. I think that's the best that we can do. Then as the system prepares to procure vaccines to come and help us, they should find us alive. The vaccines will help those who are alive, not those who are dead.
Thank you, Professor. To bring
Yeah.
you in, Professor Omaswa, you know, I guess you are aware that it's basically a very small section of our population that has been fully vaccinated. The people who have had 2 doses is at a paltry 1%. And the WHO espouses the values of equitable distribution of vaccines, and you've had the privilege to work at WHO. What can we do to ensure that we can appeal to the conscience of the West to stop hoarding vaccines, to stop this vaccine nationalism, to appeal to their conscience? That many times when we read in the media, Norway has given us AstraZeneca, and the next thing you see is Norway saying we're not using AstraZeneca anymore. How can the West be, have that, conscience and goodwill to help us at our darkest hour of need?
Well, Emma, in life, whenever there are shortages and scarcity, there is rationing, there is competition, there is hoarding. Maybe you are young, but here in Uganda, there was time when we were queuing for, salt and sugar and so on. When you get, you hold. And then in respect to this particular outbreak, some years ago, about 5 years ago, I was a member of an international commission which looked at the impact of infectious diseases on the global economy. What we published a report there called The Neglected Dimension of Global Health Security, Infectious Diseases Outbreaks as the neglected. So we are going to expect more of these outbreaks. So this behavior of hoarding vaccines was already there during the Middle East fever outbreak. And in our report, we pointed out that this should be expected. So how do we solve this? I think Africa, where we are now, it's certainly just human behavior. I look after myself first, and then the others, I can help them if I have already taken care of myself. That is what is happening. In fact, it is so bad that some countries are holding so many vaccines that they are going to expire before they are used. Exactly. They are thinking about boosting vaccination of their people when countries like ours don't have vaccines.
And the challenge is when a large population is not vaccinated.
Yes.
One, it results into the virus mutating into perhaps even
correct, and they are not aware.
Strains.
They are not aware that by not working together as global community, they are endangering themselves as well. However, now where we are in Uganda and Africa, what we should do is to organize ourselves as Africans. Let's wake up. You've heard the president saying, let's Africa wake up. And Africa has woken up. The African CDC has formed what they call the African Vaccine Acquisition Trust. And just 2 days ago, they announced that they have secured 400 million doses of the Johnson & Johnson vaccine to distribute around Africa. And then also, they are going to have 5 hubs in Africa where there will be facilities for manufacture of vaccines here in Africa. And we in Uganda, we are vying to become the hub for the East African one. We are already ahead. Here you've heard the president talk about put money into vaccine research. He's also looking at partnering with those who can transfer technology for us so that we become self-sufficient as Uganda and Africa in vaccine manufacturing. And this can happen, and it is going to happen.
Professor, to bring you in quickly, we know that I was reading the Newsweek magazine, the US magazine, and they were saying, I mean, I don't want to be a doomsday, I don't want to really be pessimistic, but they said, what if a much more virulent strain emerges, much more virulent than Delta? We know that vaccination is really the antidote to the problem. And Professor Maswa has been talking about the president's effort in terms of developing this, the vaccine. And you as a member of this scientific advisory committee, we also know that developing a vaccine requires a lot of efforts. You need the expertise, you need the financial war chest. How far have we gone in terms of trying to develop this vaccine?
I think a bit of that has been answered by my colleague, Professor Maswa, but just to say that, a journey of 1,000 miles starts with the first step. And I think the first step has already been taken here just by mere show of commitment. And we were witnesses the groundbreaking ceremony recently about a facility that will be working on vaccine production. So yeah, there are efforts. Certainly we know that vaccines are going to be the magic bullet. If you vaccinate a significant proportion of the population, then you are able to set in motion some herd immunity that will help the population in case the situation keeps deteriorating. You certainly have alluded to the fact that about these variants. The coronavirus seems to be changing. From part of the research I've read, I did find some reference to this coronavirus as being promiscuous. That is highly unstable, it wants to adapt, it wants to survive also. And part of all these mutations and coming up with this Greek alphabet chronology to name the variants, the virus is trying really to survive. And we have to be smart. We have to think outside of the box, and that's why I think we may not only wait upon the vaccine manufacturers across the board, but we look inside. But also did come across the fact that, Professor Maswa can talk about this, that there are some ongoing studies where they are trying to mix these vaccines. You take AstraZeneca, maybe then you take Johnson & Johnson, and that is trying to show a better outcome ultimately. So the rollout of these vaccines, a lot of studying, a lot of research is going on. And hopefully we shall come to a good combination that will work for the survival of the human race. I don't want to believe that the human race is going to go into extinction. I think we shall survive, we shall evolve ways to manage.
Thank you, Professor, for that. We're going to take a commercial break. We're discussing the subject of COVID-19 and the health sector fault lines. In the next part, we'll bring the debate much closer home and discuss how we can build a robust health sector to withstand pandemics like COVID-19. We'll take a commercial break. And once again, this evening we have a very distinguished panel of accomplished scientists, Professor Maswa, Professor Tumwine. Professor Maswa, there is the question of priorities. Health should really rank right there at the top. Once you have a health population, then you have a productive population. Once you have a well-remunerated health workforce, then you're able to have a productive population. Once you have equipped hospitals, then you're able to, treat all these kind of diseases. It's been the cry out there that we need to pay our health workers better, our doctors, who are quite, good. Makerere has trained some of the best doctors that have served elsewhere in the West, in South Africa, in Australia, and Europe. But we see many of these young people who have developed this great skill set leave for better pay outside the country. We also see a trend where many of our, people, our VIPs actually had established a kind of discriminatory vote that whenever they fell sick, they would fly out and get treatment in first-class hospitals and leave the rest of the population coming to, these ill-equipped hospitals. How can we address this problem? It may not be within a year, but what are the steps we need to take to see that we address this problem?
Mm-hmm. Well, those are the challenges of our health system. I would like to propose that we in Uganda do not waste the opportunity, in inverted commas, of COVID. Let's use the harsh realities of COVID as an opportunity to rethink our national health system. For a long time, decades, there are people abroad who have taught that health should benefit from a successful economy through a trickle. You focus first on economic growth, and then after the economy has grown, then the money will be available for health. Certainly that does not work. What works is first make sure that you have a healthy, productive population.
Yeah.
And it is that healthy, productive population that will build the economy. And fortunately, about 5-6 years ago, Ban Ki-moon, he set up a commission on this, and now the economists globally are now starting to turn around to recognize that investing in health, one, the health economy itself contributes to GDP.
Interesting.
And then two, ensuring that a stable health population is the population which will be productive. And it should also be educated. Years ago, even today, when I was in the Ministry of Health, we would go every year to the Ministry of Finance to ask for money. But the ministries were classified into two: productive ministries and consumptive ministries. Can you imagine that education, health, were among those classified as consumptive ministries? That is totally illogical. It is the opposite of the truth.
Yes. It's not
So
rational.
also the World Bank has turned around now. They are talking about human capital development.
Yes.
Even our National Planning Authority now, the budgeting is more talk about human capital development. That is what will turn the economy around. That's what those Asian tigers did. South Korea.
In fact, now they prioritize it to the GDP kind of things.
Correct.
Exactly.
So,
Standards of life.
so let's use the COVID crisis now in Uganda to start an internal dialogue so that we put health and social services, including education, at the center of our development. And we create people who are well educated, who are healthy, who will then be able to build the economy. High quality population. So I would like to see us now start Parliament I would like now us to start the religious leaders. I would like us to see now civil society organizations talk together, engage with the government so that we have a dialogue which will ensure that more money goes to the health sector. In fact, when I was in the Ministry of Health, the per capita expenditure was about $65. Today, it's around 43, 45.
It's declined.
It has declined. So that is really the key message I would like us to share there, that as a country, let's get out of COVID with a new health system. And that needs to be discussed. There are ways in which we can ensure that there is a minimum package of health services which is provided to every citizen at no cost through the tax base. Then we would like to see an insurance system kick in, which will provide for care beyond the minimum essential package. And the essential package was defined, but we can redefine it again. So I hope that that can happen. Now, regarding the conditions of service for health workers, you asked me that question just now.
Yeah, and part of your role at WHO was to, foster that collaboration and improve the conditions of.
Correct. The tools are there from the Global Health Workforce Alliance, how to create a system in the country which ensures that you have health workforce planning, ensures that you have mechanisms for retaining them, you have mechanisms for their remuneration, and that they are trained in such a way that sufficient numbers are there to respond to the country's national disease burden. Fortunately, just about in June, I was invited to join a delegation from the Uganda Medical Association and the Uganda Federations of Interns, and we held a very productive meeting with His Excellency, the President. These issues were raised, his response was positive, and if the decisions which were made in that meeting are implemented, we would have gone a long way towards ensuring that the health workers in this country are better taken care of. The President talks about paying scientists. Exactly. This is the time to do it.
Professor, is this the time to do it? You're part of that scientific advisory committee. What are those things that we're going to see, the pragmatism that you're going to apply in terms of dealing with this pandemic? And beyond your role, I guess you know the challenges that are afflicting the health sector. We continue seeing, hospitals without basic medicines, ill-equipped hospitals and all this, no ambulance system, the emergency services are lacking. I think Dr. Olive Kovsinja and her colleagues did quite a good report about that actually many people who are involved in accidents could have been saved if there was an ambulance. But many of them are picked by the police patrol cars and these kind of things. What are those immediate things we're going to see as we prepare to deal with another wave of this COVID pandemic?
Yeah, thank you very much, moderator. Certainly the COVID-19 situation found us not at a good standing, but it's my view that over this time, when we have been battling with the problem, a lot of learning has happened. By the way, some mileage has been covered in terms of putting together the bed space, some ambulances, even training, by the way, across board, so that people can get the much needed skills to man some of the critical centers like ICU. There was rapid training and retooling of colleagues in the profession so that they could do the job they are doing better. Ultimately, I think we have a much bigger capacity, may not be where we want to be than how we were at a time when this COVID-19 was first diagnosed. And Certainly, if you recall very well, the reason why there was a lockdown and trying to keep people home, it was to prepare. Some preparation has happened, shortcomings notwithstanding. We know that there are certain shortcomings, and at times those are learning points, but a lot of work has been done in terms of human resource, in terms of infrastructure. But I would want to add that, health is not just manufactured or happens in health facilities. It's at home. It's within our behavior, the way we carry ourselves in the community, and much more than being medical. If you touch in this COVID-19 very closely, you realize that there is a lot that could be done at an individual level, at home level, at a community level, where people protect themselves and remain healthy. Because if we are going to expose ourselves, not just COVID, but other health challenges, and we get sick, then we certainly end up putting pressure on our health facilities.
Can I chip
so
in after?
Yes.
I would want us to look at health not just as a preserve of health workers in terms of doctors and nurses and whatever, but beyond that, it's a social problem. You need social scientists, behavioral scientists, you need engineers. You can imagine our engineers have done quite a lot to help us with the shortages of oxygen cylinders and whatever. You need people in nutrition.
It's a multi-sectoral approach.
Yeah, it's a multi-sectoral approach. And so we cannot think about human resources for health in terms of only the doctors and nurses and technicians, and we stop there. It's broad.
Thank you.
Yeah.
Professor, you wanted to say something.
Yeah, right now I am the chairperson of the National Community Engagement Strategy Committee, subcommittee for COVID. And under this committee, we have published a community engagement strategy. I agree entirely with Professor Tumwine here.
Professor Muhwezi.
Sorry.
Yes.
Professor Muhwezi here,
Yeah.
that it is the people. We talked about winning and holding the trust of the people. Why do we want to win the trust and hold the trust of the people? It is because individual behavior is the prime mover of health. Maintaining health, creating health, and also containing the pandemics. So we would like to reach a stage where we have a health system in which the village has a COVID task force, in which after COVID, that committee will stay as the village health committee. In that village, there are community health workers known as VHTs, village health teams. Every village has got them. For 20 years, they have been working as volunteers. But as a result of our response to COVID, since July, the government has allocated 100,000 shillings per village health team person for the next quarter, July to September. Government has also allocated 100,000 shillings to the village COVID task committee. So we now are in a position where we should be mobilizing households through these committees to comply with SOPs. And those SOPs are very simple to me. Avoid crowds, okay? And then having avoided crowds, the next thing is that avoid confined rooms where there is no ventilation. Look for where there is ventilation. If you are not able to do that, put on your mask in the crowd, or if you are in a confined space. And then those other things about washing hands and the social distancing when you are in funerals. It should be the community people themselves, when there is like a gathering, ensuring that people are seated far apart from each other. They have washed their hands. There is some order. That is what we mean by community engagement, holding the trust of the people, so that they themselves, individually and collectively, are working to ensure that the pandemic is contained.
Professor, as we come towards the end of the show,
Yeah.
the issue of lockdowns is quite, it draws a variance of opinion.
Yes.
We've just had a lockdown which stretched for 42 days.
Yes.
And well, from you know what has happened, it generated, you know, something fairly positive, that the numbers went down and the infection rate went down. But there are those who believe that for poor countries, typically like Uganda, these kind of stringent lockdowns are quite costly when you don't have, you've halted public transport. How do, you know, does that pregnant woman living in a certain backwater move to hospital? How do poor families that, you know, have only been given 100,000 shillings for a space of 42 days, and yet we know that the National Household Survey estimates that you need about nearly 400,000 to survive in a span of a month.
Yeah.
How quickly sum up that issue? How can we see that perhaps we have a lockdown, but again it's not so extreme and defeats the purpose of having this very lockdown?
That's right. It is a very difficult balancing act for all governments. And you have heard about riots in other countries too. But in order to break transmission, you have no choice. If you don't do it, you are wrong. If you do it, you are wrong. So you weigh which is the lesser evil. And in this case, the lesser evil is the lockdown. And the way to get out of lockdowns as quickly as possible is to mobilize the communities, as we have discussed. So when we are now in this phase where there is a lockdown has been relaxed a bit, let's call upon the people now to respond so that we don't get a third wave. To follow those SOPs. And not to be confused by, there are a lot of useless things going on social media and so on. Just listen to what the leadership is saying and work with those village health committees so that they can also help to diagnose people there through the health centers. They can do home-based care so that we can, those whose symptoms can be managed at home are managed. And then we will not need to have the gross and strict lockdowns that we've had before. It is a challenge for all of us as a country.
Professor Tumwine, what do we need to do to avoid future lockdowns? How can we be disciplined? What do we need to, you know, how can we as a population and, you know, practically do to see that we avoid future lockdowns?
Thank you very much. I'm actually Professor Muhwezi. I think you like Professor Tumwine.
So Professor,
I am Muhwezi, but Tumwine is my, but there are many Tumwines who are my brothers out there. So as my colleague Professor Masa has said, it's a very serious balancing act that you have to deal with here, because you are dealing with people's survival, in terms of socioeconomic functioning, but also trying to break the spine of the disease, especially the disease of a type like coronavirus, COVID-19, where the virus moves so easily on our back. We are the ones who take it, and the way we behave. So it's a very serious balancing act that we find ourselves in. It's also very important to really, for our people to appreciate that this is within our means to control it. I've certainly listened to testimonies of people who have colleagues who have had COVID, have managed it in their home. One person gets it, asymptomatic, manages it after the prescribed time, tests negative, no other family member gets the disease. So it's a disease that can be managed once it's identified and behave appropriately. Otherwise, we do not want a scenario where our people who are vulnerable, our people who even have diminished capacity to protect themselves. As I told you, I come from the mental health field. We have people with mental health problems, and those ones have got a diminished ability to take certain decisions. So those are the ones that we would want to protect. Otherwise, if you have such a population in a significant number getting COVID-19, that would compromise prevention because they cannot, because of their mental illness. So we want as much as possible to provide a buffer by behaving appropriately, by following the advisories that have been given so that we remain safe. And that way, we shall swim ashore, we shall be safe. Otherwise, if we don't, I wouldn't be surprised if we go back to third lockdown. Otherwise, we have to get ourselves out of the lockdowns by the way we behave.
Thank you very much. We've been hosting two distinguished scientists, Professor Maswa and Professor Muhwezi. We've been discussing the issue of COVID-19 and the attendant challenges of the health sector. This is Citizen Voices, and I've been your host, Emmanuel Muteziwa. Till next time, have a pleasant evening.